Hello, I'm Sophia, an actor and sickle cell patient. In November 2021, the all-party Parliamentary group on sickle cell and thalassemia produced a report called No One's Listening. The report found serious failings in the care of sickle cell patients across the NHS, low awareness of the disease among healthcare professionals, and even overt racism. In response, we set out to listen to patients to understand their experiences of care in the NHS. We asked them to share what a sickle cell crisis feels like, how the pain can be properly treated, and what it's like to come to A&E. Sickle cell pain is unpredictable and can be excruciating. It is a medical emergency requiring timely and appropriate pain relief. It's so important to make sickle cell patients feel well looked after, particularly when they are at their most vulnerable.
It really does hurt. Sometimes when I go into hospital, like walking into A&E really hurts to get into it, and it's like a long way to get into the A&E. So when I'm in it, I'm just sitting there in a lot of pain, holding my heart, and then just holding my hot water bottle. And when we do finally get in there, we have to do some checkups before we go into that. Then I'm like, are they gonna help me or are they just gonna do checkups? Because when I'm in pain, I don't wanna do it. I just wanna get it over with, get out of the hospital, go back to normal.
The pain can sometimes be excruciating. It can really, really hurt. It can lead to, if your pain is ignored, it can lead to it being worse. It can even lead to heart attacks, seizures. So yeah, I think it should be considered an emergency.
With sickle cell, it's not always external, like you're limping or you're holding that area. It's a lot of pain going on internally, and just crying and screaming sometimes makes the pain worse. So sometimes you are sitting quietly to try and manage the pain, but that doesn't mean they're not in excruciating pain.
So I am definitely one of those that you can say don't want to go to hospital until it's an absolute must. I'm definitely in that category. I would have to be close to dying before you get me to call the ambulance. And it's because of that, it's just so overly stressful. Number one, if the crisis, because usually the crisis starts, right? And the pain might not be significant at first, but you know in your body, I'm having a crisis now. And it just gets worse. It will only get worse.
Yeah, you can't always tell somebody's got sickle cell disease. They might look very well externally, and sometimes, particularly the young men, they're challenged. They say, "Oh, you haven't got sickle cell. You're just trying to get a hit of morphine." I mean, it sort of seems unbelievable to even suggest that, but apparently that happens not that infrequently.
It started off with just regular pain in my joints, and then the pain shifted to my spine, and then I felt my spine literally breaking. And I was in that pain and just literally screaming my head off. And I screamed to the point where I passed out, right? And even after waking up, the pain was still there, but it just gets to the point where, you can't shout, you can't scream, because your voice is just hoarse. You can't say anything. Your tongue is swollen, and you're just there, just literally taking it, because there is no other choice.
It's a small group of patients, but this illness is horrendous. You have an illness that presents with pain. That's it. It presents with pain. It doesn't present with bruising. It doesn't present with swelling. It doesn't present in any other way that people can recognize the person in front of me is sick. It presents with pain. And that has impact on so many levels, and patients need support, their families need support, the teams looking after them need better staffing to be able to deliver that care properly. Trusts need to understand to prioritize the care we give to these patients.
You are not in control. It's unpredictable. That's the thing. Sickle, you cannot tell. They can be okay today playing this minute. In an hour's time, you'll be rushing to the hospital because they're having a sickle crisis. And people don't get it.
A sickle cell crisis is a serious event in a person's life and should be treated as an emergency. The pain must be brought under control and analgesia must be given to the patient as soon as possible, within 30 minutes at most. Sickle cell pain is excruciating and everybody deals with their pain differently. While some people's pain might be obvious, others may try to distract themselves or internalize their pain. If a sickle cell patient presents at A&E, it means they've exhausted all other avenues to manage their pain. When dealing with sickle cell patients, please be aware of unconscious bias, as this can distort our perceptions and lead to patients being treated differently as a result of a particular characteristic, such as their ethnicity. Above all, patients reporting their pain must be listened to and believed. Your kindness and empathy go a long way to making people feel welcome and respected. Thank you for watching this video today. Next time you look after a sickle cell patient in A&E, I hope the interaction is enriching to you and beneficial to them.